Frustration. I think it's nearly always, it's because things aren't working well. Whether it's for the patient in front of you, your team, the wider system. I mean, certainly that was my journey, and I had no intention of doing leadership. I wanted to see patients, but when things aren't working and you see that it could be better, I think you end up wanting to do something about it.
The motivations for people to get into clinical director roles are many and varied, and they've been written out extensively. There are some less favourable ones, but I think nowadays most people go into these roles with a genuine desire to make a difference, and that's it's quite simply what I hear people say all the time. You know, I saw a system and I felt if I went into that role that I actually might be able to improve a whole system rather than things just for the patient in front of me.
It's probably wanting to make a bigger difference. It's recognising the difference they can make as an individual to individual patients.
So I went into this fully expecting it to be really quite disappointing. It's been fantastically rewarding.
I think a number of things. I think it's not a single thing. I can answer better for what motivated me than for others in all probability. And I think again one's got to look at the possibilities. As a practicing clinician, one deals largely one-to-one with patients or patients and their relatives or carers. The feedback loop's rapid, the satisfaction is rapidly gained. It's fairly easy to know whether you've done the right thing or the wrong thing. It's easy to see the results of what you do. And if you're fortunate and privileged, you will significantly influence individuals' lives. As you move into management roles, particularly if you go from specialty to trust, to regional, to national, then what happens is your span of control, or your sphere of influence, perhaps is a better way of putting it, increases. So the opportunity exists to influence a much wider number of patients, or the care of those patients. What goes away is the short-term gratification.
It's the same thing that I think drives most of us to get into medicine. You want to care for people, and the older you get, or certainly the more senior you become, the more you realise the only way you can influence things is by getting involved. And you can't really complain if you're not involved and things aren't happening how you want them to. It was an interesting decision for me because I was diagnosed with prostate cancer at 48, and then I relapsed 3 years after that. So I had a couple of bites with cancer, and that sort of puts your life into context. So for me, I was confident I had 5 years left to give full steam ahead, and I wanted to do something meaningful for the bigger sort of system. So that's why I took the role at a Special Measures Trust. It's been tough, but boy, have I learned a huge amount.